Good morning, everybody. I'm Chris Wilson. My company is Modified Independence. On these screens is what you're going to see is a STEADI Fall Risk Assessment. I meet and we meet and you meet seniors on a daily basis who claim that they are not a fall risk. They haven't fallen. I've never fallen. I don't have anything to worry about. I tell people all the time, you are a fall risk if the injury that you sustain when you hit the floor is something that's going to impact your abilities to do ADLs, period. If I fall off of this stage and I break my arm, I'm 48 years old, I can probably wash my butt with my left hand, right? Now, if I'm 78 years old and I fall off of this stage and I break my arm, I can't stand up in the shower because I'm probably on pain pills and there's only one hand to hold on to the grab bar with. Which hand am I washing my butt with? Sorry, I'm an OT. I talk about washing butts because it's a hard thing to do. This afternoon, after I'm done interviewing Susan Warnberg for 7 Minutes for Seniors, I'm going to a house of a 66-year-old woman who fell. It was her first fall. When I look back at her medical record, she was taking 19 medications. She is paralyzed from the shoulders down because of the first fall. The first fall. If you leave here with nothing else, I want you to understand the importance of this test and the importance of the first fall. The first fall is what earns people a walker, a cane, a wheelchair, a breathing tube, a feeding tube. The first fall is the biggest injury to your ego. Can you imagine what I would feel like if I fell off of this stage right now in front of all of you? That is a bruise to my ego. That's exactly what our patients and clients are dealing with. They're dealing with this massive bruise to their ego. That's the reason why they don't tell their kids that they fell. That's the reason why they don't tell their doctor that they fell. We go to patients' houses all the time with an order from a doctor, and the doctor will have documented the patient has never fallen. As soon as we walk in the house, the husband's like, she falls every Wednesday at 2 o'clock. Like clockwork. You know, like they know, they share this stuff with us. Why do they not tell the doctor? Because they're afraid that they're going to end up in a facility. They're going to end up in the hospital. They're going to end up on more medications. They're going to end up with surgery. They're going to end up with all of these things that they consider to be needless. What is needless is this 66-year-old woman that I'm going to see today with a spinal cord injury. That is what is needless. What is needless is a gentleman that I met last year who was 67, something like that, going to see his sister in California, was taking a blood pressure medication his doctor just put him on. He's sitting at the airport. He stands up to put his jacket on because we all know it gets cold in the airport. He stood up to put his jacket on and blacked out and went face first and caused a traumatic brain injury. So this test behind you, the STEADI Fall Risk Assessment, is proved by the CDC and Medicare, okay, to determine if somebody is in fact a fall risk. It's not a test of performance. As a therapist, I would do the timed up and go, where you stand up from a chair and then you walk 10 feet and you turn around and walk back, right? That requires a doctor to be able to qualify and quantify how a patient moves. The doctors don't have time for that. Hey, does anything hurt today? What's your blood pressure? Are you taking all your meds? How's the kids? Yeah, any other concerns? See you later. And they're out the door, right? How is a doctor going to have time to actually do a timed up and go test? Why don't they do this? This is very simple. All right? Has anybody fallen in the past year? I'm not going to ask anybody a question that I can't answer myself. I have fallen in the past year. I had alcohol in my system. It doesn't say what was the cause of the fall. A fall is an unintended descent to a lower level. That's it. That is the definition of a fall, not, you know. I had a lady who broke her back one time, compression fracture of L4, because she sat down on the couch too hard. She didn't control her descent. An unintended descent to a lower level is a fall, period. That's the definition. It doesn't matter where you're sitting down to, what your intention was or whatever. If you don't control your descent, that is a fall. All right? So I get 2 points already. You've been advised to use a walker or a cane. It doesn't say by a physical therapist, by an occupational therapist, by a doctor. It says you've been advised. That means your kids could have told you. Your neighbor could have told you. The person next to you at church could have told you, you know what, Betty, you should probably use a walker.